Okay, so I'll go ahead and start and tell you. This is domain one. Domain one: sleep study, preparation, and performance. Preparation and performance. And from this part, there's 45% of the questions will come from this domain.
Domain one.
Yeah, domain one. 45% of the questionnaire will come from this domain. And from domain one, sleep study, preparation, and performance, and this it has been classified or categorized into 4 different domains. Like task A, task B, task C, and D, right? 4 different domains. So we are going to study just like domain 1, A. So we started verifying clinicians' order and testing indications. So what it means is like when the patient comes in to your sleep lab, you need to be able to tell like what kind of sleep study you need to perform. So there's a different kind of sleep study. One is like standard sleep study. Number 2, titration. And okay, let's open verifying clinician's order. Okay, so in this if we read, like it says, before conducting a sleep study, it is crucial to verify the clinician's order to ensure the test is appropriate for the patient's condition, and this process includes number 1, checking the type of type of sleep study. What kind of sleep study is ordered? We need to know. Okay, so normally how many types of sleep studies given here? Home sleep study, in-lab sleep study, split test, CPAP, MSLT, MWT. So there's 6 different types of sleep studies, right? The one is like home sleep study. Home sleep study, that is done in the house, home sleep study. Another is like in-lab sleep study. And in-lab, that's a standard, that's called PSG, NPSG. Home sleep study is called HST normally, or HSAT, home sleep apnea test. And in-lab sleep study is called PSG, or it is also called NPSG, nocturnal polysomnography test. So that's NPSG. And the next thing is split night. Split night, like split means 2 part, half and half, standard as well as like titration. So the both of those together we do sometime. And the next is titration. All right, I can maybe find out. Do you? Okay, let me see. There is a ResMed, like there's a 2 big companies. There's a many companies, but 2 big companies, ResMed and Respironic. And they have like different they have different types of home sleep study. Okay, let me show you one home sleep study.
At any time in the setup, you can
Okay, this is 4-minute video. This is for home sleep study. Okay, let me show you this. All right, check it out. This is home sleep study. You see this device? It is called Apnea Link Air. This is the very small device. This is called home sleep study device.
Your clinician has recently given you an Apnea Link Air device to get tested for sleep apnea in the comfort.
So we keep it in a small bag, and we keep like other wires and everything inside that box, and we give it to the patient.
Of your own bedroom. Don't worry, it's simple and easy to use. ResMed Apnea Link Air is a device which helps to detect sleep apnea in one quick and simple overnight study. This short video will help to familiarize you with ResMed's Apnea Link
So you see how that guy, this patient, took the device and now he's going to use it. Okay, it is very simple device.
Air and make sure you use it correctly and efficiently. At any time in the setup, you can also refer to the patient instructions
So the instruction page is also given to the patient so that they can see and they can use it.
provided by your clinician to get further details. When you open the pack, you find several components: the Apnea Link Air Recorder, the belt, its effort sensor, the nasal cannula, and the pulse oximeter. We'll explain each of these parts as we assemble the system. The Apnea Link Air Recorder and effort sensor will most likely already be attached to the Velcro belt supplied. Now,
So here, this one is like sleep apnea monitoring home sleep study device. Okay, this is the device, and this is effort belt. This is called effort belt. And you remember yesterday we had effort belt, 2 effort belts, chest and abdomen. But in home sleep study, we use only one effort belt on the chest. And this effort belt also has home sleep study device on it.
before you go to bed for a normal night's sleep, you need to assemble and attach the components. Take the nasal cannula, which measures airflow, with the 2 prongs facing downwards, like this.
So this is called nasal cannula, okay? So nasal cannula that goes to the nose and it monitors the breathing with the help of like air pressure.
Loop the tubing over each ear and tighten the toggle under the chin. Make it snug, but not so tight that it's uncomfortable. Insert the end of the nasal cannula into the recorder, turning it clockwise.
So this home sleep study device is connected with mainly the nasal cannula device and another one also. We'll see.
Your healthcare provider may have already done this for you. The one remaining task is to attach the pulse oximeter device.
Yeah, this device is called pulse oximeter, okay? And it monitors your oxygen saturation and pulse rate.
Place the index finger of either hand in the sensor, or if you're using a disposable sensor, on the adhesive and wrap it around your finger.
Yeah, this is pulse ox. This is called pulse oximeter. This one and the other one is the same thing. Only the difference is look, this one and that one is same. It's not a different. This is made of rubber,
In the sensor.
and this is reusable,
Or if
and
you're
this one is
using a disposable
disposable.
sensor,
This is
on the
disposable.
adhesive and wrap it around your finger, as shown here. Secure the line using the tape supplied.
So in that way you put the tape over there so that it will not come off easy.
Now, you can attach the oximeter to the belt alongside the Apnea Link Air Recorder. If you're an active sleeper, you can also tape the nasal cannula tube to your cheeks. The system is now fully assembled and ready
Now see,
to start recording.
this is ready. This is so simple, but we don't do this. This is done by the patient, by him themselves. We just need to understand how this works, or we need to understand how we assemble or how we do the home sleep study feeding, so that we can tell our patient. Okay, so this device, ResMed Apnea Link Air, records sleep apnea.
Start the Apnea Link Air, pressing
Look.
the on-off button for 2 seconds. The central green light will illuminate. It will dim automatically after 10 minutes. After a few seconds, the small lights on the sides will illuminate.
You see, all these 3 lights are green now.
If any light blinks red, check that the accessory corresponding to the light is properly placed and connected. Once corrected, it will switch to green after a few seconds.
So whenever something is loose, those lights are going to blink red. So in that way, when the patient is sleeping, suddenly it starts blinking red, then the patient need to understand like it is loose somewhere. So he need to fix it, either this one or nasal cannula or pulse ox.
When all lights are green, you can go to sleep as you would normally do. The Apnea Link Air will monitor your sleep during the night, documenting your breathing patterns and possible respiratory events. When you wake in the morning, turn the recorder off by pressing the button for 3 seconds. The light will turn off. If the test complete light goes green, you have successfully completed your overnight study and can now return the device to your healthcare provider. If the test complete light is red, contact your healthcare provider as the test may not have been successful. Press the on-off button another time until the test complete light turns off, and return the Apnea Link Air system to your clinician for the analysis. The Apnea Link Air has now recorded a wealth of data about your sleep patterns. This data is downloaded and analyzed on your clinician's computer. Your clinician will
See, this way, this is the data. This is the report of sleep test. Now here, like this blue is hypopnea. Okay, blue is hypopnea. So I know you have a question about what is hypopnea, what is apnea, those kind of question, right? So, okay, just remember this term, hypopnea, apnea, and like other things, snore.
will be
I'll
able to
tell you
assess
those.
whether
Look,
or not you are
here they have like this guy like having partial obstruction from here to here. This from here to here, he did not breathe normal. This is his normal breathing. Okay, this is his normal breathing, but this did not breathe good. His breathing is decreased by 30%. But in this here you see his breathing is good. But now in pink, he did not breathe at all, like a straight line. Over here, you see, that is straight line. That means he did not breathe. So, okay, if this is the scenario, I will tell you what happens. This is normal breathing, okay? Like
suffering from sleep disordered breathing. But rest assured, there are suffering from sleep.
okay, this one is like it's breathing. You see, the breathing pattern goes whenever the pink means completely stop breathing. The blue means breathing but very difficultly. Like when the breathing comes, this normal is like this is normal. But when a hypopnea comes, that means like that kind of breathing. Somebody's breathing but not breathing, fully. So in that way,
breathing.
after the doctor checks all this
Rest
report,
assured, there are simple therapies that can be offered to treat these conditions and relieve you of the debilitating symptoms. Your clinician will happily tell you more on your options.
okay, so here we saw like home sleep study device. It's a very little device. It goes right here, and it goes one belt, effort belt, one cannula, and one pulse ox. Okay, like only two extra devices are connected. One is like this one, nasal cannula. One is pulse ox. Pulse ox monitors oxygen saturation, and they also monitors your pulse. You know the pulse, right? Pulse rate. So it monitors the pulse rate And normal pulse rate is like let's say it is supposed to be over 90 from 90 to 100, which is pulse rate. But like sometimes it goes below 40, and by which we can say that that's a bradycardia, like heart problem. If it goes higher than 100, it is called like the tachycardia. It goes tachycardia is another heart problems. We will study about heart problem, then you will know about those things too. But here we have to focus on home sleep study. That's the one thing. Now in lab sleep study, let's check in lab sleep study. Do you have any question about home sleep study?
No.
Okay. So I will show you another in lab sleep study.
I'm the Sleep Center Manager
Okay.
here at Bozeman Health Sleep Center, and I would like to take this opportunity to explain the process that you are about to undergo. You are here tonight to undergo a
Okay. So this way,
sleep test.
patient sleeps in the sleep lab. That's the in lab sleep study.
This study is also
See?
known
And the hookup is done according to our 10-20 measurement system. This one is a little bit different. This one is a little bit different.
as a polysomnogram. Sleep studies are used to investigate complaints of daytime sleepiness with registered
So here you see, she is doing the hookup patient. Now she's putting right now C3, right? She's putting C3.
polysomnographic technologists and respiratory therapists, and we are accredited by the American Academy and shown to you.
So normally when they come to the sleep lab, they ring the bell. I mean, just like they pick up the phone. Not
Sleep
this system
study.
is maybe
You will
different.
be greeted by
In the hospital, they pick up the phone and it rings the bell
one of
inside.
our
The
technologists
technologists come out and they go. They will welcome the
and shown to your
and they'll
room.
take him
It
in.
is our goal to make you as comfortable as possible during your sleep study. Each of our rooms are designed
So the rooms are set up just like a house, like a hotel. It's not like hospital. But some, some sleep labs have like a hospital setup. They can use hospital beds, but most of the sleep labs are just like a hotel.
When you come for your sleep test, you should bring anything you need to be set with the top and bottom.
Like in this
The
way,
pants will help to contain the leads that are attached to your legs. Silk
they're putting the leg wires.
and satin fabrics and nightgowns should be left at home. Get yourself familiar with your bedroom body. It is important that you
You see, this is the yesterday we checked. Okay,
it is important that you understand
yeah, this one is.
your body. It is important
You see, this is EKG sticker. It goes right here on the collarbone. This is the collarbone. It goes right here,
that you
right?
understand that this process is painless.
This is leg
This
wire.
equipment allows us to record your sleep, and the hookup process takes about 45 minutes.
You see, this is the belt, effort belt. There's a two different effort
The first
belts.
group of electrodes are placed on your scalp electrode
And
placement.
then they will have to do the measurement.
Once
10-20 measurement.
identified, these positions will be cleaned with the substance that will allow
And you see, this is the new prep. She's cleaning with the new prep. Okay.
a maximal transmission of signals
Okay.
from your body to our computer.
And after that, she will take some 10-20 paste, this one, with the with the electrode, and place over there.
Electrodes are then placed by your
And next comes like this one, this tape. With the help of this one, she's putting right here. But you can use a different kind of tape too, and she's
eyes to
using
monitor eye
different.
movement, and on the chin to monitor muscle tone.
See, chin goes right here,
All of these electrodes help
and now you can see the full head hookup right here. Chin, eyes. This is F3, F4, and C4. This is CG. This side, like this is C4, C3, F3, C4, C4. Sorry, F3 and C3,
give us a better picture of your sleep.
and it becomes like this.
A sensor with a bright red light
And this
placed
is the sensor. pulse
on one of your
oximeter,
fingers. This measures the amount of oxygen in your blood.
just like the
Nail
other one.
polish will interfere with this
Home sleep
measurement,
study had
so
the
it is
same kind of
necessary-
thing. Okay.
This sensor measures the airflow
Okay.
coming from your mouth, and
And after
most
that,
people
patient will go to sleep.
sleep just fine after
Just
the
like
hookup
this.
is complete.
And in this case, sometimes the patient, when they're tossing and turning, their wire may puff off. At that time, we have to go and fix it. Every time the sensor comes, altered, or the wire comes up, if the head wire or any wire, comes up, we have to go and fix it.
You are encouraged to sleep in whatever you haven't done so naturally. Occasionally,
And the
progresses.
technician will go monitor here. You see?
During the night,
Technician
the
will
sleep
monitor.
technologist will monitor the
There's
video
a
and
patient
information
sleeping.
from the electrodes.
You can see
Depending
there.
on the results we begin to see,
And
you may be awakened during the night so that
Right. Look, what happened is the first test was called 95810. Standard test, polysomnography, or called NPSG. Sometimes the patient may be very severe, like this patient is very severe. That's why the technician is putting the mask at the middle of the night. And that test becomes, instead of 95810, that becomes 95811. Split test, okay? That becomes a split test. Normally what happens is, they come, patient has to come second time in the sleep lab to complete their sleep study with the treatment. But this kind of test, in the same night, we do two different tests that's called a split test.
the technologist can initiate CPAP therapy. You may be familiar with the disorder in which a
Okay, now you see here, this is the nose that the people breathe, and it is open, like this, open. Now what
patient's
happens
upper
is,
airway, including palate or tongue,
so normally here, like this is nose, the air goes from nose, this is mouth, the air goes from mouth, this part is tongue, the muscle, tongue right here, and this is called the palate, and the muscle in our mouth part, okay, nose and mouth, normally mouth. So what happens is the tongue and the muscle gets relaxed. Look at this.
collapse into
Look. You see what happened? Okay.
or tongue,
Look, this tongue is going downward, right?
collapse into
See? It is collapsing. Now in this case, what you see is like,
the airway.
what you see is like the airway is collapsed, like here.
Palate or tongue, collapse into
See the little small spaces right here, right? It was open completely before. Now it is open completely. The air can pass. It's so easy, so nice.
including palate
Because of the tongue is
Or tongue,
sliding
collapse.
backward, so it is closing the airways.
into the air.
See, it's closing the airways, and because of that reason, patient will not be able to
Right.
breathe. Look, this is blue is air. It's not going through the airways. It's coming backward. The patient is breathing like that. The other side, like the pink one, obstructive apnea. Okay, obstructive apnea is completely blocked. This situation is called obstructive apnea. Obstruction means completely blocked. Obstructive apnea. So in this case, what happens is somebody breathes in, but the air does not go in the body. It goes out, like completely holding the breath. That is called obstruction.
Preventing a patient from breathing normally.
Look,
CPAP is short for continuous positive air. Your ordering provider, electrodes and wires, is
and in the
painless.
morning,
You may then take a shower,
you can take the wires off and
get
clean
dressed,
and
and go on with the
let
rest
your
of your day.
patient go home. Now this is the this is in lab sleep study. Okay, in lab sleep study, and the other thing is we discussed about 3 sleep study. Standard NPSG 95810, we discussed about split night, half NPSG, half CPAP. And the CPAP titration, okay, CPAP titration is complete CPAP titration is when they come to the sleep lab and directly use the sleep CPAP machine. Okay, let me show you.
When we breathe,
But did you understand about the sleep apnea?
Yes.
Okay, look at this sleep apnea.
air travel
When we sleep, at the time the air travels like this.
down the throat, through the windpipe and into the lungs. The narrowest part of that pathway is in the back of the throat. When we're awake, muscles keep that opening relatively wide. But when we sleep, those muscles relax. That narrows the opening.
See, the airways is getting narrowed. Our air pipe airways is getting narrowed. So when it gets narrowed, but the air is still passing, that is called hypopnea.
The air passing through may cause the throat to vibrate. That
That vibration of the throat is
causes
called
snoring.
snore.
Obviously, many people experience this, but in some people, the throat closes so much that enough air
Okay. Now look, you see,
that enough air doesn't get through to the lungs. When this happens, the brain gets a message to wake up. The brain quickly activates the muscles that hold the throat open. Air gets through again, and the brain goes back to sleep. This only takes a few seconds. You may not even know you've awakened, but this process may happen over and over, hundreds of times, all night long. You may never get into the deep, restful stage of sleep. As a result, you may feel exhausted when you wake up and feel sleepy all day.
yeah, that is called sleep apnea. Okay. Very common, very normal thing, like our airways, because of our tongue and all the muscles in our mouth part. When we sleep at night, it just starts relaxing. Because you know, when we sleep, we go relaxed. That means our muscle gets heavier. So it gets heavier and tongue starts sliding backward. And that's why it blocks the airways. So normally people cannot sleep on their back because the tongue goes flat, blocks the airways. Okay, that's why people always try to sleep on their side so that they have a little bit opening on the mouth part and they can breathe. So the same thing, that's part. When it is blocked partially, it is called hypopnea. When it's blocked completely, that is called apnea. Okay. Now, but we still have to learn those things. Okay. Now let's go and check in our canvas again. Okay. Okay, so here the first thing to verify what kind of sleep study, home sleep study or standard in-lab sleep study or CPAP titration or split night test or MWT. Normally this MWT, which is called maintenance of wakefulness test, that doesn't happen. That's very uncommon. The other one is like MWT and MSLT, multiple sleep latency test. That also can happen. So we have like 6 different tests over here, and then we have to figure out doctor's signature is over there, and all this thing we have to make sure. Number one, you see, in number one, several things we have to check. Number two, testing indication, like testing indication is number one. Here you can see like it is written obstructive sleep apnea, right? Obstructive sleep apnea.
Yes.
Let me show you. Look on this one. Here, testing indication, obstructive sleep apnea. Obstructive means when it is completely blocked, that is called obstructive sleep apnea. Okay. Obstructive sleep apnea is completely blocked like this. You see, the air is not able to go in. So this problem is called obstructive sleep apnea. But when
The throat
the
closes so much that
Look.
enough air doesn't get through to the lungs.
so if it cannot go through, that is called obstructive apnea. If it
When
can
this
go
happens, the brain
little
gets a
bit,
message
that is
to
called
wake up.
hypopnea.
The brain quickly activates the muscles that hold the throat open. Air gets
Okay, that is called central apnea is next thing. Central apnea is something you see like right now here what you see is
air gets through again and hold the
Look.
throat open. The brain gets a message to wake up. The brain quickly
see the brain whenever sleep there's an obstruction, our brain tells us, hey, you're holding your breath, open. And then when brain sends the signal, then
activates the
it
muscles
opens
that
the
hold
airways
throat
and
open.
we can breathe. Okay? But there are problems like sometimes because of this let's say some kind of brain injury. Some people have brain injury. They fell down, they hit their head somewhere. In that case, they do not have like their brain does not send the information or do not send the this order. Yeah.
The brain quickly
You see this order, the brain cannot send the order. That's why if somebody is holding the breath, he will be holding. And that problem is called central apnea. Central apnea because of brain. Because brain forgets to tell our body to breathe. So that kind of problem is called central apnea.
activates the muscle.
Okay. So here, like in the testing indication, you can check here central apnea, and then okay. In the testing indication, there's a central apnea, and there's narcolepsy. Okay, this is narcolepsy. Okay. Narcolepsy and yeah, like okay. So okay, so next thing is here insomnia. I will tell you briefly about the problem, this problem. Narcolepsy is some kind of problem. People have very sleepy, excessive disorder, sleeping disorder. That is narcolepsy. I can give you, okay, narcolepsy. Let me show you what is narcolepsy is. Okay.
Narcolepsy causes me to fall asleep anywhere between 4
Look, this problem is now this lady is talking right. Okay. This lady is talking right now, right? Look, when she is talking, now she's talking.
which can leave me quite vulnerable in certain situations, public transport, or if I'm by myself without a friend. So it impacts on everything I do really, because you just have to think about things that somebody who didn't have narcolepsy wouldn't have to think about before doing something simple. Even something like going swimming. I don't go swimming anymore because there's a risk that I could have cataplexy
You see, she was talking. Suddenly she fell asleep. That is narcolepsy. And this is so dangerous. Like it happens, this is a problem. Like so many people are, having this problem. This problem is called narcolepsy. People collapse anytime when they're talking, when they're studying. So they may collapse anytime. That's the narcolepsy. In narcolepsy, okay, maybe I can show you another video. Yeah, to do the narcolepsy test, we do MSLT test. So narcolepsy. Did you understand the narcolepsy a little bit about?
Yeah.
When somebody, even like it, yeah, it can happen
a
really.
person actually with a history of narcolepsy and videotapes. Let's take a look at that. So here she is describing like these dance motions, and then
Okay, now let me show you really dangerous kind of like narcolepsy. Okay, check this out. This lady is dancing.
So let's take a look at that. It's to having just
Capture
to
the moment.
capture this moment, right, on the videotape. So let's take a look at that.
She's
So
dancing
here she
right
is
now.
describing like these dance motions, and then we'll see
Look.
just this abrupt like loss of motor tone, and because this person has underlying narcolepsy, we'll actually see like this person just goes out this
That's so
profound
unfortunate.
deep sleep. So a terrible actually circumstance. To
That's
have.
what cataplexy just.
So this is narcolepsy problem. It's so dangerous. If somebody is dancing, talking, suddenly they collapse and they sleep. They can sleep 24 hours. And there's so many problems. Narcoleptic people are in the area. Never know, in our church, in our society, there may be so many narcoleptic people. They're falling asleep all the time and they don't know. They don't know they have narcolepsy, because the narcolepsy, the severity of the narcolepsy can go so high. When somebody is driving, they fall down. So if there is narcolepsy, people are not allowed to drive. They cannot drive. They fall asleep anytime. So that kind of problem. Now the next problem is like insomnia. You see, insomnia. This insomnia is very common. Insomnia is actually very common. This insomnia is very common. Like insomnia can happen, chronic insomnia or just short-term insomnia. Like people, when you travel from here to Nepal, in the completely different hours, because you used to sleep during the day, like here you sleep at night. When you go to Nepal, it's the same time. It's going to be night or day over there. Right now it's night over there. It's day over here. So because of the timing different, maybe not able to sleep. Like I work at night, so I sleep during the day. And right now, even right now, you can feel like I'm kind of sleepy from my inside. And when I try to sleep at night, it's so difficult for me, because it's very difficult for me. I normally don't sleep during the night. So being a sleep tech is a little bit difficult in that part. Most of the sleep tech, I sleep like 3 nights, 4 days, right? Because I have to work, like tomorrow I'm working, Wednesday. So I don't sleep normally at night tonight. And tomorrow morning, I go to sleep so that I can work at night. So this timing difference causes me having a hard time falling asleep. That problem is called insomnia. But this insomnia can cause because of the medication, because of some kind of family disturbance, problems, depressions, stroke, those kind of thing also causes. I can tell you, like when I lost my daughter, I had a hard time falling asleep because everything come into my mind. So That's another thing. Insomnia can happen. Now the next thing is restless legs. Restless legs. Like restless leg is something people, just kick their leg when they sleep at night. They kick their leg. This is a problem too. They, having like warm sensation, burning sensation on their leg, and they rub like this, or they kick their leg like this when they sleep at night. And parasomnia. Parasomnia is sleepwalking, sleep talking. Do you know anybody? Have you heard anything about sleepwalking?
My mom talking to sleep.
Yes, that's a parasomnia. Sleepwalking. Normally the kids will have sleepwalking. There's several examples, several cases. There are so many problems in sleep apnea, like parasomnia. People even can get up, cook, eat, and go to sleep, and in the morning they come to the kitchen and they see, they think like, who cooked it last night? They did it by themselves, but they don't remember. They go, cook, eat, go to sleep. That's kind of like bad parasomnia. Sometimes people just get up, eat from their desk, they eat because they put their food over there. They get up, they eat on their sleep and drink and go to sleep. And they can do several things during their sleep. Some people go drive, and when they're driving, they're sleeping. They're sleeping, they're driving, and suddenly when they wake up, they're on the sleeping clothes, and they feel like, oh my goodness, I'm driving right now. How did I come? They will not understand. Amazing thing you can see because of the parasomnia: sleepwalking, sleep talking, sleep terror. Like many times people see dreams. They are called sleep terrors. Okay, and another is chronic fatigue, like tired, all day tired, all day. Daytime sleepiness. During the day they feel sleepy all the time. That is another problem. So in that way, we, because of being a sleep tech, we need to make sure that we are verifying all this thing, okay? And that's why, here's another thing, like, that's why sleep referral form is over here. We talked about that yesterday. Okay, let's discuss about history and physical. Click on the history and physical questionnaire.
Yeah.
Okay, the first thing here you see, this is the history and physical. History means patient's medical history. Physical means their height, weight, their medical problems, like all those things, the present thing that is detected or diagnosed of. The first thing here you can see, like name, date of birth, address, phone number, their primary care physician, spouse name, employee address, emergency contact, employer information. And this is what we ask patient. We give this form to fill it before we do the sleep test. This is like insurance thing. They put their primary insurance so that we can charge them, and this is the release of information. Like they have to make sure they have to release their consent, like, so that we can do the sleep study. Now this is history questionnaire. Okay, patient name. The questionnaire is like, we ask them several questions. The question here is like, in as much detail as possible, please describe the problems you are having. Like they will explain over here, I have a problem of falling asleep and I just keep awake all night. They may say that I snore at night, They will say that my wife told me I hold my breath during my sleep. I keep frequently wake up. They may say like I go to restroom, I use the restroom 2 to 3 times, like those kind of thing. And we keep asking question. Have you had a sleep problem diagnosed before? They will say yes, no. If yes, when? Where was the study performed? And if yes, what was the diagnosis? Did your doctor told you that you have sleep apnea? Same thing like here. Are you currently on CPAP? CPAP machine. Are you using the CPAP machine? Do you have you seen the CPAP machine yet?
No.
Maybe not. Okay. But you know what is CPAP mask, and you know that, right? Okay. Okay, I'll show you that one too. And the next thing is, you see, how often does the problem you are experiencing occur? Like, how long this problem, or problem of sleep problem, like, how strongly do you want to help this problem? Or this all sleep problem. How do you describe your sleep problem? You see here, says, how do you describe your sleep problem? Number one, I have difficulty falling asleep. I wake up repeatedly through the night. I wake up far too early in the morning. I feel excessively sleepy during the day. I find it difficult to wake up in the morning. So this kind of question, okay? There's so many questions are here, and they will answer this question. And more question. Look, they have to tick mark. I exercise, I sleepwalk, I wake up short of breath, I wake up gasping for air, I wake up coughing, I wake up confused, I have trouble breathing while asleep. If they have anything, they will mark over here, tick mark over here. I stop breathing while sleeping, I get morning headaches, I have frequent sinus congestion, I wake up with a dry mouth or sore throat. So this is like a whole bunch of questionnaire here that we collect from the patient. Now we also collect the medications. See here the medication, and we collect like medication, reason for taking the medication, dose, and date. And this is called Epworth Sleepiness Scale. Epworth Sleepiness Scale. Okay. Here what it does is like, it starts from 0 to 3. So 0 to 3, it says like if you never doze, 0. Slight chances of dozing. Dozing means sleepy. If you don't sleep, 0. If you do little bit, that is 1. Sometimes, number 2. Every time or high chances of dozing is 3. Okay, I will ask you, tell me, when you're sitting and reading something, do you fall asleep? When you're reading something, do you fall asleep? What number you want to give for this? You want to say, I don't sleep when I read. Or you want to say, very little.
I yawn a lot.
When you're reading, when you're sitting and reading something.
Yes. Like feel sleepy.
Oh, you feel sleepy? So number 1 to 0, 1, 2, 3. What number you want to give?
Maybe 1.
1, okay. You know 1 means sometime. Okay. Now next thing is watching TV. Says watching TV. What number you want to give?
0.
0. Okay. When you watching TV, you don't fall asleep.
No.
Okay. Sitting inactive in a public place like movie theater or church or a meeting, do you fall asleep?
Yeah. Sometimes 1.
Sometime is 2 or 1 or whatever you want to do. 2 is a little bit higher. So you want to give 1? Okay. As a passenger in a car for an hour without break, that means a long drive. You are a passenger, sit, and somebody is driving for you for hours. Do you fall asleep on the road?
Yes. Sometimes.
So 1, 2,
2.
2. Okay. The next is lying down to rest in the afternoon when circumstance permit. That means when in the afternoon you're laying down on your sofa, do you fall asleep?
Yes.
So what? Number 1, 2, 3.
3.
3. Oh, okay. All right. Sitting and talking to somebody. When you're sitting talking to somebody, do you fall asleep? Like we are talking right now. Do you think like, oh, I may fall asleep? Do you feel like that way?
No.
No, 0. Okay. Sitting quietly after lunch without alcohol. That means after lunch, you did a good lunch. Do you fall sleepy?
Yeah. 2.
2. Okay. Now, in a car, while stopped for a few minutes in a traffic, you are in a traffic, few minutes, 5 minutes, 10 minutes, you are waiting in a traffic. Do you fall asleep at the time?
No. 0.
0. Okay. Now, according to your data, according to your number, I'm going to count it. Now, let me tell you, if this number is 7 and higher, most likely you may have sleep apnea. Okay, so your total comes like 1, 2, 3, 4, 5, 6, 7, 8, 9. Your score is 9. That means you may have sleep apnea. Okay, you may have sleep apnea. So this is kind of like scoring, by which the Epworth is something. Whenever we do, Epworth is like screening for sleep apnea. Now, when I tell you what happens to the sleep test, I mean sleep apnea people, it is scored 9. You may be thinking, oh my goodness, do I have sleep apnea? So normally what happens, people with the sleep apnea, they go to bed and have hard time. They feel very tired. They cannot go to sleep right away. They do tossing and turning. And they sleep, but they cannot lay down on their back. Because you know their tongue can go collapse. They cannot sleep on their back. Never. But they try, but they cannot. So they sleep on their side always. Now here's the first thing. Do you sleep on your back? Question.
Yeah, I can.
You sleep on your back?
Yeah, I usually sleep.
On your back. So, okay. So it is difficult. It is difficult. So that means you snore. If you have sleep apnea, you may snore. And snoring 2 kinds. One is like regular, and another is like this is called snorting. If you do this, that means you hold your breath. You may have sleep apnea. Next thing, you wake up after 2 hours. You go to bed 10, 11, and then you wake up 1 o'clock or 2 o'clock suddenly. And you think like, why did I wake up? Oh, I don't know. Look at the watch. Maybe I have to use the bathroom. Then you go use the bathroom. Come back and go to sleep. Again, 4 o'clock. You wake up. Go to the bathroom. If that is the situation, that may be the sleep apnea problem. Okay? So anyway, this is the way, this is the screening, sleep apnea screening. Epworth Sleepiness Scale is for sleep apnea screening. So there's a more chances. Now, okay, this is our last part of sleep questionnaire. So we do this kind of sleep questionnaire, and then from this sleep questionnaire, we can tell our patient may have sleep apnea. Okay? So this comes on history and physical. Now,
So we have to do this now before we.
I'm sorry, say again?
Do we need to do paperwork and together?
Yeah. Normally, the one, did you print that out?
Yeah, I need to.
Okay.
I'm going to print it.
Okay. So the one in your hand, that is the sleep referral paper that you get from doctor. The doctor sends you that one in the sleep lab, and you go check what kind of sleep test is ordered, height, weight, everything. Doctor writes and signs. That's sleep order. And we also give patient this history questionnaire. And you can find history questionnaire in the patient chart. And from that you have to go study all those questions. Then you can know like patient has sleep apnea or not. Like this way, if you do the sleep questionnaire, your sleep Epworth scale is 9, then it seems like, okay, you may have light sleep apnea. Not moderate, but light sleep apnea. If this score is more than 15, then you may have moderate sleep apnea. If this score is more than 20, you may have like severe sleep apnea. So this is the way we can say that, okay, this patient may have sleep apnea. Okay, so this is how we find out, and this is how we find out whether a patient has sleep apnea or not. Now let's see, do you have medication?
No, I don't.
You don't have that. Okay. Canvas. Okay. Let me publish this one. All right. Now, can you check it out if you have now? You have to go back to module and
Domain 1, right?
domain 1,
No.
third one, medication.
I have only the active physical.
Okay. You have history and physical.
Yes.
And after that?
I have nothing.
Okay. I just published it, but it seems like it's going to take some time. Shouldn't it take some time though?